afternoon, everyone. Today we have Alicia. She'll be doing PRP and stem cell treatment for her hair loss. Are you excited, Alicia?
I'm so excited. I'm so ready for this.
So what's going on? How long have you had thinning hair?
So my hair thinning started approximately 5 years ago. I had approximately 8 years prior to that, various treatments of IVF. So I lost a lot of hair once I was able to have my children, and I delivered immediately after, lots and lots of hair loss. So back then, which was approximately 4 or 5 years ago, we had PRP, which brought back a great amount of hair. But after that, we had the pandemic, and I feel that due to me having had COVID a couple of times, my hair fell out, which is one of the results that we have from COVID.
I get to see clients.
So
regularly.
again, my hair has thinned out despite all that I've tried. I'm just at that point now where I know I have to do something more aggressive because I am prone to losing a lot of hair.
A lot of hair, yeah.
And oh my God, I'm so excited. I want to do this so bad. I know that I've heard great results, and I'm excited. I'm ready for it.
The whole thing's gonna take less than an hour, or about an hour. There's no downtime. A lot of clients come in, do this at their lunchtime at the office. I wouldn't recommend it because your hair would be messy. When you do it at lunchtime, do it, on a day off or at an hour before you leave the office. Leave early for an hour and go home. Just because your hair is gonna be messy. Okay, so expect to be with us for about 45 minutes to an hour, no downtime. The only things you can't do once you leave our office is working out today. So no gym today. Don't eat spicy food today, because when you eat spicy food, it makes the scalp sweaty. And what we're gonna do is we're gonna microneedle your scalp, so we don't want you catching an infection. No hair products, just for today. Don't wash your hair for 4 to 5 hours. If you have nowhere to go, keep it on till tomorrow. We're going to inject the PRP stem cells, but you're gonna have some residue on the scalp. Just leave it on the scalp, okay? So once again, no downtime. Really all you have to think about is no products in the hair, no spicy food, no gym. Don't wash the hair for 5 or 6 hours. If you have to go somewhere tonight, you want to wash it, wait at least 5 hours. If you don't have any plans, wash it tomorrow morning, okay? So what I'm going to do now is I'm going to draw your blood. You have a preference, right versus left?
My right.
Right arm, okay. So we're going to draw the blood. It's going to spin for 14-15 minutes. We have your stem cells already ordered. We're going to mix the two. I'm going to apply topical numbing cream on top. We're going to disinfect it. I'm going to microneedle your scalp to cause micro trauma, and we're going to introduce the stem cells and the PRP. It takes about 2 minutes, the actual treatment, but the wait time is about half an hour to 45 minutes, just because we have to apply the numbing cream, okay?
Perfect.
I'm going to hand you the mirror. Show me the areas that you would like me to focus, concentrate, so on and so forth.
Okay.
Here's a mirror.
So, more than anything, just basically down the center of my scalp. I felt that this is super thin. Everyone that looks at me when I have my hair up can see straight through my hair, and they can see my scalp. So everybody's like, what's going on with your hair? I have been using minoxidil for about 6 months now, and I did get some baby hair back. Right?
Because you don't have this much density 4 or 5 years ago.
I did not, absolutely not.
So the PRP did help, and then the minoxidil helped maintain what PRP gave you. PRP, 2 sessions is what we typically recommend, but since you're doing stem cells with the PRP today, all you really need is 1 session per year.
Fantastic.
And if you're maintaining it with the minoxidil, you can actually do PRP stem cell treatment not every year, maybe 1.5 years, every 2 years.
Fantastic.
As long as you're using the medications to maintain and keep.
Yeah.
Awesome. Thank you. All right, Alicia, I'm going to ask you to relax. I'm going to put in a little traveler's pillow. Okay. Going to get you nice and comfortable. While you're here, I'll get you the remote, watch a movie or a show on TV, okay?
Okay.
I'm going to disinfect your scalp. Push the head as far back as you can. Are you comfortable?
Yes.
All righty.
Now I am.
This is called Chlorohex. This is going to disinfect your scalp. Sorry if I get some of the makeup off the forehead. So we're going to focus on the temples, mid-scalp, the crown region.
Mm-hmm.
All right. Next thing you know, you'll be done. You'll be set. All right, Alicia, going to Chlorohex. I'm going to continue disinfecting. Push the head back for me. I'm going to disinfect the scalp. One more time. Remove any of the hair products you might have. Temples, hairline, mid part way. Bring your chin down a bit. All right. Have you noticed that you have some thinning as well in the crown?
Yeah, it's like a generalized hair loss everywhere. I lost it like evenly.
And that's the main difference between male pattern compared to female pattern hair loss. When it comes to hair loss, Alicia, there's 5 patterns. Pattern 1, 2, and 3 are typically for men. Pattern 1 is when there's hair loss in the front and the back at the same time and they meet in the center. There's a pattern 2 where the hair loss starts in the front and then eventually recesses towards the crown. There's a pattern 3 in men. Looking at someone from the front, you can't see that they have hair loss. It's when they look down, you see the bald spot. And there's a pattern 4. This is where most women fall. What's the main difference between men and women? Women never typically lose the hairline. They never typically lose the crown. They have diffuse thinning from the center, and over time it just expands out to even to the temples.
That's exactly what I have.
Yeah.
That's
So what I want to do is I want to show you what your crown looks like back here, and I think we might also want to introduce a little bit of PRP stem cells for the crown as well. Okay. Let me show you. Tell me. Take a look. You see this back here? So we're gonna focus. Bring your chin down a bit to your chest. Yeah. I'm not sure if you're able to see the reflection back here.
Yeah. Oh my. It's very obvious, isn't it? Mm-hmm.
Yeah. So we're gonna take and cover all of that as well. Okay.
I'm at the right place.
Thank you, thank you. All right, Alicia, I'm gonna apply the numbing cream. Any allergies as far as, you know?
With medications, only the sulfas.
Sulfa, okay.
Mm-hmm.
Push that back for me. Alrighty, I'm gonna apply some numbing all across. This is the part that takes the longest, okay? I want this on the scalp for about 45 minutes, half an hour to 45 minutes. Basically, the longer this stays on the scalp, the less sensitive it's going to be, okay? Bring your chin down a bit. That's it. This is it. What I'm gonna do now is I'm going to draw the blood as well. I'm throwing a fresh pair of gloves. Keep this on for at least half an hour. And I'll get you the remote. Get to watch the show on you. All right, Alicia. We're gonna draw the blood. You mentioned your right arm. It's a preferred arm.
Mm-hmm.
Draw the arm. Draw the arm for me. You have a really good juicy vein right there.
Mm-hmm.
And have you squeeze this emoji. And when I do this, I want you to turn the opposite direction, okay? Sometimes clients get a little bit lightheaded when they see their own blood being drawn. Pump, 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 pump. Drop the head, look the other direction, push the head back for me. Here we go. On the count of 3, here we go. 1, 2, and 3. You did it. Good job. How bad was that?
Nothing. I feel it.
Good.
Good hands.
Almost there. We're collecting 35 cc's of blood, okay?
Mm-hmm.
get you some juice as well, okay?
Thank you.
Got it.
So far, it's
Almost
great.
there, almost there. You got it. All right. Take a deep breath for me. On the count of 3. Here we go. 1, 2, 3. You did it. Good job.
It's out.
It's out.
Good job.
Thank you, thank you. I got it. Put on a little band-aid for you. Okay. I need you to put pressure here for about 3 minutes, okay?
Okay.
Well, if you want, keep this on here, rest the arm. What I'm gonna do is I'm going to have this spinning, and then this is gonna take about 14-15 minutes. Once it's done spinning, we're gonna come in and do the microneedling and the treatment.
Yay!
Sounds good?
Can't wait.
All right, awesome.
Okay.
I'll be back, Alicia.
Thank you.
All right, Alicia. It's time to do the treatment. Ready? Push that back for
Ready.
me. I'm going to disinfect the scalp one more time, okay? How many hairs would you say you shed approximately in a day? Bring your chin down a bit.
Just to wake up on my pillow, there's at least like 10 on the pillow.
Okay.
And then to shower, let's say another like 20.
Okay.
And of course the brush
And do
is,
you wash your hair every day?
no, not anymore.
Okay.
Since you told me to not do that. I
Well,
changed my shampoo.
sulfate rich,
Hmm
multivitamins.
I no longer dye my hair like with a ammonia-based dye. I only do water-based, kind of like a henna, like
Got it.
what you suggested.
Yeah, your scalp has actually improved from the very first time I saw you a few years ago. The minoxidil, topical minoxidil is really helping. PRP did. I'm very so happy for you. All right. We're gonna do the microneedling next, okay? This is what the microneedle looks like. Okay, it has over 500-600 microneedles. What we want to do is we want to cause micro trauma so the growth factors get activated, okay? Turn slightly to the left, turn up towards the ceiling. Let me give you a little squeezy in case if it's a little sensitive. Now I'm looking for pinpoint bleeding, okay?
Mm-hmm.
We go in semicircles. Chin up towards the ceiling for me. Beautiful. Pain scale, Alicia? How would you rate it? You could be honest.
6.
6 out of 10.
Yeah.
All right. I mean, it's just 500 needles, 600 needles, right? Bearable though?
Mm-hmm.
Perfect.
temples are always more sensitive.
Absolutely.
Mm-hmm.
But I'm so surprised on how much density you got from the topical medications in your previous treatment.
You could see
This
it.
is all new.
Mm-hmm.
All right, chin up towards the ceiling for me. Not fun, I know. Sorry.
Mm.
Turn this over. It's not pulling your hair, is it? Did it pull your hair?
I'm outside my body.
Alright, bring your chin forward. Now we're gonna do the back. Meditating.
Mm-hmm.
Nice. But you're doing great. There we go. Alrighty, you did it.
Yay.
Good job. Push that back for me. Alright.
Definitely the temples and
The temples are a bit more sensitive.
the hairline seems.
Perfect.
It's warm from the.
Microneedling?
Mm-hmm. I feel it, you know, it's like when you scratch it, it feels warm.
Yeah.
Mm-hmm.
Let me show you. Hold the mirror. Look at the pinpoint bleeding. You see that?
Oh, yeah.
That's what you want. We want to cause micro trauma.
Mm-hmm.
Alright, Alicia. These are your growth factors or platelets, the PRP mixed in with the stem cells. We're going to introduce this to your scalp, to the thinning areas, okay? What are the benefits of the PRP stem cell treatments? Reverses the miniaturized hairs. So if you feel like your hairs are not as thick and coarse as they used to be, as long as they're active and living, it can help reverse it. That's one benefit. Second benefit is decreases the shedding. Third, expands the life cycle of the hair. Fourth, extra density is seen. These will never take the place of a hair transplant. So I don't want clients who are a hair restoration, hair transplant candidate to think this is a miracle cure. It's not. This is for clients who are at the early stages of thinning. Clients can always do PRP stem cells when they do a hair transplant, because it can also help with the recovery and healing, higher survival rate of the grafts. You can always incorporate these with a hair transplant. But as a standalone treatment, clients who are not either a candidate for a hair transplant, is like a lot of women lose the donor on the temple, their density is thin on the sides. Usually that's not the best candidacy for hair restoration, because for us to be able to do a hair transplant, where do we extract the follicles from?
Mm-hmm.
Right temple, left temple, back of the head. Earlier I mentioned how women typically lose their hair is they keep the hairline, they keep the back, they have diffuse thinning from the center, and it comes down all the way to the temples.
Mm-hmm.
So if we're gonna do a hair transplant on a female client, if their temples have thinned out, not the strongest candidate.
Mm-hmm.
So this is why we have these secondary options, such as yourself. If your temples have thinned out, not a good follicle to take, to implant, there's a good chance it won't take, or it's going to file.
Mm-hmm.
Men are programmed differently. Men lose the hairs on top, not the sides. As long as they're not going to be a class 7, these don't have the receptors, so when we relocate them to a new area, hairs stay for a very long time. If they're gonna be a class 7, then those hairs can also fall out, but typically they stay at a 6 normally, most of the time. Okay, so those should be until well in their 60s and into their 70s. But anyways, talking to you, these are your stem cells. We're going to introduce it to the areas that we discussed: temples, behind the hairline, partway, and the crown, the whorl. Sounds good?
Yes.
All right.
I can't wait, I'm excited, because last time that we did the PRP, I got all of those benefits that you said. I got all of that.
Did you?
And we didn't do stem cell.
Not
back
everyone
then.
gets these benefits, but most do. Out of 10, about 7, 8 love the outcome. 2 or 3 might say, you know what, I'm glad I did it, but what are my other options? Most say that, if not all say, I've seen a difference in shedding. So if they're losing 100 hairs a day or 500, whatever that number is in a week or in a day, that number is now down, where it's maybe quarter of that, which is also a plus. That means they get to keep what they have much longer. But most get all 3 report benefits. Okay? All
Yeah.
right.
Can't wait. How many months?
Takes about 9 to 12 months to see the results. Some clients have said as early as 3 to 4 months they see a difference. Okay? All right. Turn slightly this way. You're also going to feel a little vibration device. Okay? This is to distract you from feeling the injections. It's a very, very thin needle. It's used for Botox. Okay? All right. You ready? Here we go. Apologies in advance. Here we go. 1, 2, and 3. Turn slightly to the left. This is the most sensitive portion. Here we go. 1, 2, 3. 1, 2, 3. That's it. Turn slightly this way. Let's do the left side. There we go. 1, 2, 3. One down.
You know, the stick doesn't hurt. I mean, it's the sting of the solution, like a little bit after. It's not horrible.
Good. Good, 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 good. All right.
Well, so far, right?
So far. Well, we started off with the most sensitive areas, the temples and the hairline. Okay. Here we go. 1, 2, 3. You feel the vibration helps a little bit? That's it. You did it. Push that back for me.
I think the anticipation is worse than what it is. Just thinking.
Let's look how fine, look how small the needle is. It's very thin. All right, Alicia, here we go. You're doing great. Pain scale?
Like a 7. Well, maybe not. Maybe less.
6, 5, 4.
5, yeah.
You said 7 initially.
Yeah, but
Certain spots?
I mean, compared to the first part, the microneedling was a little bit more
Was it?
intense
So this
than
is less intense.
Yeah, because this is more like a sting, like sting. The stick doesn't. I don't feel so much. It's the solution that just kind of, I guess,
Got it.
stings, maybe.
Alrighty. Here we go. So we did the hairline, we did bilateral temples, we're also doing the partway mid scalp, and I did the whirl as well, okay? Here we go, Alicia. Okay, I just have a small droplet. Bring your chin down a bit to your chest. Think of somewhere special to place this.
I'm looking at your.
There we go.
Mm-hmm.
1, 2, and 3. You did it. Good job. All done.
Yay.
All right. What I'm going to do is I'm going to gently microneedle the area one more time, okay? And you are all set. All right. Push that back for me if you can. You feel like this is more sensitive
Mm-hmm.
than the actual injections?
Mm-hmm.
Doing great. You are doing fantastic. And like I mentioned, Alicia, you have to wait at least 9 months to 12 months to see a difference. Some clients swear at 6 months they see a difference, 3 months out they see a difference. Some clients have also said a few weeks out. Too early, I always say with at least 9 to 12 months.
Last time, the person that noticed the hair growth right away was my the person that cuts my hair.
Mm-hmm.
They were the ones that were like, "What are you doing?"
You know what's funny?
And I was like, "Why?" And I hadn't noticed that it was growing yet. And he's like, "Look at all this hair. It was tiny." And he showed me, and he's like,
Hairstylists,
Mhm.
hairstylists all the time, they refer their clients because they've seen the benefits of hair transplants or stem cell PRP treatments. You are all set, my friend. You did
Okay.
great. So what you're gonna do once you leave our office is you're not gonna wash the hair for how many hours?
"Or
More like 5 or 6, I should say. If you have nowhere to go, wash it tomorrow. If you have a place to be tonight, you could wash it as early as 5 or 6 hours. I don't want you working out sweating today.
nothing today."
I don't want you eating hot spicy food, makes the scalp sweaty, and I don't want you applying minoxidil tonight because the pores are open from the microneedling. You could continue with the minoxidil, topical minoxidil tomorrow morning, okay? Tomorrow you could do whatever you want. There's no restrictions. These are it for today.
Beautiful.
Any questions you have, I could help answer.
No.
If you
Yeah.
feel a mild headache coming on, normal, you could take a Motrin, Advil, a pain reliever, should perfectly fine, but most clients don't need it. Some might just take it. Yeah,
Just
so
in case.
just in case. So feel it, let me know, I'll get you some. Otherwise, you are free to go.
Yay. Thank you.